one thing that I think we should talk about is that because the AAN's annual meeting this year is a more pared down experience to fit the virtual format, and a lot of recognition that there will be a bit of overlap between conference offerings and that people do want to be able to attend much of it. They obviously pared back a number of different offerings within many different sections and subspecialties of neurology, and sleep saw that as well. And so I think what the intention was from all of the offerings that I see available, so they really focused on the practical, right? We don't want to make you a sleep specialist with this year, or most any year, actually. It's exciting. These are cool disorders, and it's really worth thinking about. But in this year's meeting, really all of the offerings that exist, from the sleep and melatonin talks in neuroscience to the insomnia talk by Dr. Westwood, are really emphasizing how can you actually address these types of things in your patients that you might see just a standard neurology clinic for anybody who's a neurologist. So that's one aspect that I want to highlight, is that the AAN did a really great job of maintaining the relevance to its main population of neurologists, that anybody might be interested in these sleep topics. And in future years, obviously, we can expand back out to some of the more in the weeds type of stuff from sleep. But then another thing is that this year they put onto one of the plenary sessions, I think it's Contemporary Issues plenary session, a talk by Dr. Phyllis Z, one of our sleep experts in the field from Northwestern. And she's going to be talking about the question of daylight saving time, which is a topic near and dear to my heart. It's something that I generally feel we should get rid of. And I don't necessarily feel that we need to be in daylight saving time year round, or necessarily need to be in standard time year round, though there is a great amount of evidence and a lot of support for staying in standard time year round, that I think would, if I had to vote one way to stay in one particular time frame for the entire year, standard time seems to be physiologically the healthiest way to go. But I totally understand people's desire to be in daylight saving time year round, because in the winter, you want a little bit of time after work to be able to have some sunlight. But I think that's something that will have to be sorted out. But I think the overwhelming body of evidence is suggestive of daylight saving time transitions, creating social jet lag, imposing unnecessary health risks to individuals, are not desirable and certainly should be done away with. So far, this has been kind of a grassroots phenomenon. There are a couple states who don't do it at all. Other states who have put it on the ballot and decided, okay, we can think about this, or even enacted it. For example, in I think Massachusetts, they're planning on going to Atlantic Standard Time. But really, this seems to be an issue that's gaining enough momentum that it really needs to go to the top and really be something that's advocated for at the federal level. And so fortunately, the American Academy of Sleep Medicine has put out their position statement, and I feel a lot of the sleep physicians within the neurology community certainly appreciate the value of that and are trying to help our community in general understand the issue and weigh in as brain specialists to say this is healthy for the brain and healthy for the body, and see where we should fall on that. And I think that's why the AAN is prioritizing this as a plenary talk, to make sure that it's in the consciousness of our general neurology community, because it impacts them. It impacts their patients, right? We have circadian influences on headache disorders. We have circadian disruptions and neurodegenerative disorders. So it impacts a lot of what we see in neurology. And so I think that's why this is going to be put up on the platform, and make sure that everybody hears about this topic and can actually give their opinion and voice to what is the best way forward. And it seems like most definitely it's stopping the transitions that are unhealthy. But the question is, well, where do we land? Are we landing on some sort of solar time equivalent, or a standard time, or a daylight saving time year round? What's that going to be? What's that going to look like? And so Dr. Z is an excellent person, being a circadian specialist, to bring that data together and really present the case for the community to understand it better, and hopefully that they can give their opinion and weigh in.